Welcome to No Pain, More Gain. I'm Dr. Nayda Nunez, and today we have a special guest, our patient and friend Amy Brady. In this episode, we will talk about pain, what it means, and how to navigate it. Amy will be sharing her personal journey with pain, and she will be offering insights that many of you may relate to. Welcome, Amy.
Great. Thanks for having me.
Hi, Amy. Amy has been a patient of ours for more than 10 years. She has been a blessing since day one she stepped into our office, and we're so happy to have her today in our podcast.
Thank you.
Hey, Amy, I have a couple of questions. Do you remember the first time you came to our office and what was bothering you? I remember.
That day is etched in my memory forever. Can I tell the real story?
Of course.
Okay. All right. So I ended up in your office by accident. And I say that because I know God was in control of that moment, but it felt like it was by accident. Somehow I had gotten an address of the chiropractor that I was headed to I had been referred to him mixed up, and I ended up in your office. And as I sat there longer and longer, I realized and I didn't see that person's name anywhere. And I began to kind of just get generally confused. So I remember it came that my name got called and you came right about the time I realized this. I was like, I think I need to tell them I'm in the wrong place and I need to go. And you came and called my name. So we stood there and I told you, and you're like, well, listen, it's up to you. If you want, you can come in. We're happy to help. I told you, like, how I liked my neck adjusted and how I didn't like it adjusted. And you're like, we're not going to force anything on you. This is totally up to you. And I was like, I kind of like this chick. So I'm going to give this a chance. And I came in and it was like the best oops ever. So, yeah, I
Oh,
came in because I think back then, I am pretty sure I was having a lot. Yeah, I was having a lot of pain in my neck. Um, like the discs in my neck. And so I was just always having upper shoulder pain, headaches. My neck was stiff all of the time. I thought, is it the pillow? Is it the mattress? Is it this or is that? I had had an accident many decades before that where I had a severe whiplash as a passenger in a head-on collision that my husband and I were in on our anniversary night going to dinner.
oh my God.
And it was like my right shoulder had come forward. And so ever since then, I had little babies at the time. So I was always carrying them on my hip, with one hip popped out, my spine tilted to the side. And it was just always an issue. I always had pain there. But it had gotten a lot worse, like not able to sleep, not able to function well. Um, I'd been seeing an upper cervical chiropractor at the time, which was great because it kind of eased me into chiropractic care because I was a little concerned. I've never done it. Um, but I felt like it wasn't doing enough for me. And that's how I ended up in your office.
Great, great. Well, I think it was a blessing to have you as a patient. More than 10 years ago. I don't even remember the year, but it was a long time ago.
Yeah, exactly. Exactly.
Um, I have a question. What do you think about pain, Amy?
Oh, that's a big topic.
Hmm.
What do I think about pain? I think pain is one of the biggest ways that our body tells us the truth.
Absolutely.
And whether it's physical pain, emotional pain, mental anguish, whatever, I feel like it's a truth speaker to us. And I think it takes time and care to learn to listen, especially for women. We're on the
Exactly.
we've
Mm.
kind of been taught to push our needs aside, and it can take an absurd amount of time before we actually put all the dots together and go do something about it, especially
Exactly. So,
physical pain.
yeah, and it is so related. You're talking from the heart, I can tell, and from experience, how pain affects your muscles, how your emotions affect your muscles, and how sometimes you have to put it aside because you need to take care of your son, because you need to be there as a wife, because you need to go to work and take care of other people, right? We are wellness providers, both of us. And of course, to a holistic providers, we need to care a lot about other people. And sometimes we put our needs behind, but learning to listen to our body and to the truth that our body is speaking to us takes a lot of mastery,
It
is experience
does.
being there. So I can tell you are listening to your body slowly from 10 years ago to now, you even listen to your body better.
Oh, yeah. Oh, yeah. And it's been a long road and a lot of different avenues to learn how to do that well. But it always serves me best. Always. It never steers me wrong. It's always correct. And for me, having a pretty extensive personal trauma background, my body just learned a survival technique of just disassociating. So it was just disassociating from how my body felt, that trauma response kind of, we get numb. We don't notice. We kind of shut the body down because I feel like for me, my body was the scene of the crime. And so being in my body was very difficult and painful emotionally. Um, but I reached kind of a threshold, which was probably about the time that I came to see you. I reached kind of like a threshold where I literally couldn't physically do that anymore. I had to address it. And I wasn't as good at it as I think I thought I was.
Oh, I think you made the first big step. I always say that the way to empower yourself is by acting, right? And you did the first step in making that appointment and stepping into an office and making yourself vulnerable and talk to
Mhm.
somebody about how you feel. My slogan is turning pain into power, because pain happens, like you said, because it's telling the truth about something. We have pain because of an injury, yes, but then what happens after the injury and that pain from acute becomes something chronic that lags with us for years?
Mhm.
Is there muscle memory? Are we remembering something that happened that is there in our quiet moments and is trying to tell us, you need to fix something more than your physical pain. You need to work on your spiritual healing. You need to work on your emotional um, stability.
Yeah, definitely. Definitely. I mean, I now know exactly when certain, like if I start to have a lot of pain in my thoracic spine area, and then the muscles and ligaments that run off of that underneath my shoulder blades, underneath my scapula, will get very, very hard. And I'll just have this pain back there. And that's when now it's become like, oh, I'm hurting back there. There's a particular relationship in a couple that when I'm struggling with them or I'm carrying grief or pain in my heart in those areas, it shows up there. It's almost like I consider that part of my body the backside of my heart,
Mhm.
you know?
Absolutely. You're
And I'm like, oh,
feeling the feelings.
exactly. I'm like, okay, so when I'm feeling it back here, that means it's been going on for a while. It starts in the front for me and then it radiates to the back. When it gets to the back, that's my body's way of saying, can you stop and think through these things? Or can you make an appointment with your spiritual director? Or maybe you need to make an appointment with your therapist. Or maybe you need to get away for the day and just have some quiet to reflect or do something you enjoy. It's become a signal for me. And now I know almost like what's going on in my body according to where I'm feeling the pain.
Yeah, it's a combination. They call it the three T's, right? The thoughts, how your thoughts are affecting your body itself and your spirit. What are you telling yourself? The other T is trauma. What traumas have you had physically? Like, yes, you had a whiplash, other things like you lost somebody, you're grieving somebody. That's a type of trauma. and also the toxins. What are you putting into your body? What is that you're
Mhm.
having for breakfast, for dinner? What is the cologne you're using? And also the aromatherapy that, you can build up or change how good you feel depending on how you think, how you feel deep inside, what you think and your thoughts, the traumas you had, and the toxins you get your body away from or put your body into. When we talk about the physical part of pain, how do you feel about the modalities like laser therapy and adjustments itself?
Well, I have to say that one of the things that I loved about coming to your practice, and that kind of was the hook for me to stay, was it wasn't just coming in and getting an adjustment and then leaving. When it was like, oh, now we're going to do ultrasound, I think was one of the things that I use. And then there was the traction table. Like I had like this, I would come in and do all these little things. And then there was uh, the tense unit. And I think we did some acupuncture at one time, some massage at one time was like part of when I went. And that holistic piece of the chiropractic care made me literally feel cared for. And it brought me back because my body felt so nurtured and nourished when I went for just a chiropractic visit. It was like a highlight. It was almost like at that point in my life, it felt like a spa treatment for me,
Yeah,
and the music, like you guys had the aromatherapy and you had like the music, and I was in a very, very intense time of life then and carrying a very heavy load as a caregiver. And when I went there, it was almost like my best kept secret. I'm going to the chiropractor. But I
mhm.
was felt like I was going to the spa for the day, and I would leave and people were and everyone that was there was kind, and it was just an all around life-giving experience for me.
Thank
So
you.
all of those things, I don't even still to this day know any practice that offers all that. So when I was referring people, I'm like, look, you're not gonna go and just get your neck adjusted is what people think of, right? When your spine adjusted, when they
Mhm.
think of chiropractic care, like you're gonna get a lot more bang even for your buck. They're not gonna just do one thing and send you out. Like they really are trying to help your body heal. So yeah, I loved all that. When y'all started doing laser therapy, that's been really huge for me at different times in my life when I
Absolutely.
would, you know, we age, we grow, we do things, we get hurt. We're people. And I mean, I'm coming in regularly um for that right now. I have an Achilles issue that popped up on a trip that I took where we had to do a lot of walking. And so knowing I have that actually kind of decreases my anxiety about my injuries,
Absolutely.
because I'm like, oh, there's many times that I'll do something. I'm very cautious, but occasionally I'll tweak my back, like my low back. I've learned how to, lift things, pick up things, and just from my yoga training, like how to twist with my body in particular ways to be more mindful. But sometimes you sneeze the wrong way when you're at 50 and it changes everything. So, here I am, I gotta follow up. And sometimes I'll sit with the pain for a few days and then this light bulb will go off and I'm like, oh my gosh, I can just go get the laser therapy. And I did that recently before I had to go on a trip. And within a day or two, I just even forget that my back was hurting me because it's been effective for me. So I've really enjoyed that one too.
I am so, so happy that our patients have the opportunity to have different treatment options or protocols to incorporate to their pain-free journey. And it takes away a lot of that, like you said, anxiety, the fear of having pain sometimes is even worse of having
Hmm.
pain itself. So
Hmm.
taking that heaviness of what about if it hurts? This is going to interrupt my vacation or my daily
Hmm.
activity
Hmm.
as a caregiver, as a mom, as a grandma. So having that extra tool is amazing. and having also the opportunity to serve our community and patients like you with compassion for us is an honor because we have a commitment of empowering patients to live pain-free. So thank you for trusting in us, Amy. I wanted to spend a minute also talking about your journey as a yoga facilitator. Can you talk to us about that?
Oh, yeah. Um, so I got into yoga, as just, a practitioner, someone who was practicing yoga, um, in 2016. We had, over the course of the 4 or 5 years before that, adopted 2 daughters, and our daughters came to us by way of, international adoption, and both of them had special needs. One of them had an undiagnosed special need, actually 2 when she came home. Um, One was easier to manage, and the other was like a mystery. It ended up being autism, but it took about 10, almost 11 years for me being daily and constantly relentless with doctors and specialists and practitioners, just advocating for her and demanding that she be seen and thoroughly examined and challenging their diagnosis at times. Saying, I hear what you're saying, but that's not what's happening in my house. And so finally found a gift of a psychiatrist who was able to help us the most. And out of that came the autism diagnosis, which opened the doors to a world of support and help and understanding and really lifted a burden off of her. But I was carrying all those burdens before. As you know, one of our daughters had 4 surgeries within a year because she couldn't walk. It was just a lot, and then we had other children marrying, going to college, going off into life, and I ended up in depression. And but it was one of those mommy depressions, meaning you just keep doing what you're doing and you keep being there for people, and no one really probably knows that the depth of what you were carrying. So I ended up doing yoga as a way to combat the anxiety and loved it so much that I went through a couple of trainings to do yoga and even a trauma specification for that. And so, yeah, I remember many times coming in to get adjustments with you, and you were just like, the yoga's doing a lot of the work. And that actually inspired me to keep up my practice because, and even today, I like anybody will have weeks or seasons or a month or so where I kind of get out of it, not completely, but not as much as usual. And I keep going back to it because I realize it's a core piece of how I take care of myself because it ticks all the boxes. It keeps my muscles stretched. It keeps my tissue soft. It keeps my emotions intact. It gives me a place to just go step on a mat and leave everything else outside. It's probably the only thing I think that I'm able to do that actually where I can block everything else out. Even if I go take a walk, I kind of take my problems with me and just like process them. But when I go to do yoga, I'm literally completely present in a way that I'm not able to be in other places.
Well, and then is a way to control a lot of the things around you, right? You can control your breathing and how much you move and how much pain can interfere with your movements or not. So having yoga as the safe place, your quiet corner, and also chiropractic is amazing. And the fact that you work so hard to find those two, and also absolutely prayer, right? That's something I
Mhm.
know you do every day. Like you had found self-care and
Yeah.
also self-love through all these mechanisms to cope
Yeah.
with your pain.
Yeah. I mean, yoga is how I feel like God taught me to listen to my body. It was literally the beginning of it. I can look back and go, before that, I didn't have that. After that, I've had it, and grown increasingly over the years just by showing up. I mean, yes, I've gotten the training and it's taught me to be more mindful and all of that, but it's really come from the practicing of it. It has helped me to be more in touch with my body, to notice, honestly, to really notice where my pain is, whether it's emotional or physical. Whereas before I maybe wouldn't notice something for a long time. Now I notice it immediately. It's helped me in when I go to the doctor for anything. If it's a checkup, if it's this or that, I can say, I'm noticing this, I'm sensing this, I'm feeling this. And then I'm able to get insight or support or help for that. Whereas before, I wasn't as acutely aware of what my body was doing or how it was feeling. And because I have a better understanding of that, I am a better advocate for myself. I'm like,
Absolutely.
no, I'm telling you something is off. No, I know I'm feeling this. I don't let myself, which women can experience a lot in doctor's offices, get talked out of what I'm experiencing. I don't allow anyone to talk me out of that
Absolutely
anymore.
not. Nobody knows your body but you. That's I always tell the patient, I can see whatever X-ray, MRI you have, and if it's clear and you telling me you feel something is wrong, we're gonna find what it is. Nobody knows your body but you. And that note, Amy, do you have anything to say about yoga and being a Christian? A lot of our patients, we had these conversations before. Some of my patients, when I recommend them to do yoga or Pilates, I am a Pilates advocate. I love Pilates, but I think yoga works other areas as well. So they seem a little bit unease about trying yoga as Christians. Do you have anything to say about that?
Well, I have a lot to say. That would probably be a whole other podcast. I was that Christian who was afraid of doing
I
yoga.
remember.
The reason I did was because after a period of not taking care of myself for about 5, 6, 7 years, um, when I started going back to the doctor, which I thought I had been to the doctor, like my gynecologist, my therapist, my chiropractor, and my general practitioner. I thought I'd been to all these people the year before. And when I went to make the appointments, they were like, no, you haven't been here in 4 years. You haven't been here in 3 years. And I was stunned how much I had stopped taking care of myself because that was things I did all the time. I
Mm.
always had my appointments, yearlies, dentist, all those things, and I had stopped. And when I got those appointments made and I went to go see those practitioners, every single one of them was able to detect that I was dealing with depression better than I was, which I'm thankful for that. But they all suggested yoga. And I got to thinking, okay, so God knows where I'm at. He sends me to these people and he allows every one of them to suggest yoga for me. At that point, I had lost so much of myself and I had lost so much of my connection with God in the way that it used to be before all those years of heavy and suffering and trial. That I kind of just felt like I was going to throw my soul to the caution of the wind. And what I mean by that is like, I am going to free fall into God's grace. Either God is there and he will guide me, or I'm on my own. And I don't believe I'm on my own. I feel like he's big enough to take care of me if I stumble into something I shouldn't. He's going to redirect me. So what I'm
Absolutely.
going to do is I have nothing to lose because I've already lost so much. I have nothing else to lose except my very self. And I'd already lost so much of that. So I just did it. I did go to the Y because I felt like it was a little bit less what people like to say woo woo. I didn't know a lot about yoga studios, so I was cautious. I'm like, it's going to be more just like stretching, and they're not going to be introducing a lot of Eastern mysticism in a yoga class at the Y. Right. And I was right with that. I got there and that was the case. So it was a really good introduction. And then someone invited me to Christian, a Christ-centered yoga practice. And I went and did that and realized that it created a space for me to connect with God and pray that I didn't have anywhere else. Like I told you, when I got there, I was really present. I could push everything out. So then I started coming to the practice because this was my place to actually kind of reconnect with God. Because when I was anywhere else, I was inundated too much with life to be able to focus. And then my husband noticed a change in me, for the good. And because I began to go, I don't know if I should do this. What do you think? And his thing was like, I can only think of one being that would try to make you feel guilty about connecting with God,
Hmm,
and it ain't him.
exactly.
So I just took that and ran with it, and all the time saying, okay, God, if I'm in the wrong path, on the wrong path, if I'm going in the wrong direction, I am asking you to turn and put me in a different one. And that never happened. So I kept doing it. I connected with other Christians who had found
Amen.
yoga to be a practice that was helpful to them. And then it just went from there.
It's great. Great experience. I remember in the office that one day we treated you and I said, Amy, there's yoga for everybody. There's goat yoga. There's whatever yoga. There
Hey,
has
I've
to be
done
Christian
kangaroo
yoga.
yoga.
Oh, there we
Exactly.
go.
I've done kangaroo yoga. I actually became a big part of a community online that a
Amazing.
young woman that I was mentoring at the time began. It's still going on. It's called the Yoga Abbey, and it's a contemplative yoga space. So you come there and you have all these different practices as far as like power yoga and slow yoga, and there's devotionals and there's different prayer methods, and so I kind of found my space and my people, I guess you could
Great.
say, with
Great.
it. And yeah, so that really helped a lot too. Yeah.
I'm so happy for you. Amy, thank you for your time. Can you tell us a little bit more about your journey at Evergreen Soul Wellness?
Yeah, I started that a couple of years ago as an LLC to kind of combine all the different things that I kind of do. So there was the yoga piece and then the trauma sensitive yoga piece. I'm a writer and author, and so my writing, different places that I contribute content, was there. So it was just kind of this place of it was like this holistic place, this embodied faith. So I feel like my journey led me to embody my faith. My faith wasn't just something outside of me, it was something inside of
Mm,
me, that my physical body was a part of that. I don't think as Christians enough that we respect our bodies the way that God would intend us to, whether it's how we eat or how we care for ourselves. It was a place of, embodying my mental health alongside my spiritual health, a place of where people can come and talk about the struggles they have with their spirituality and spiritual health, and just kind of helping people connect all of those dots together. So I'm a spiritual director, which means I basically accompany people on the journey of their faith at whatever point they are. Sometimes we need a safe place to go talk to somebody and be unjudged for how we feel about our faith or how we feel about God or our confusion or our pain in those areas. And so that's a service that I offer to people. And then a lot of different things. I've done retreats, taking some women on a pilgrimage to Scotland in a few months.
amazing.
Um, yeah, different things like that.
Gracias. Amy, do you have
De
your
nada.
information there? Your website
Yep.
information?
Yeah, just evergreensoulwellness.com is where you can go and find a lot of stuff. I have my Substack. It's called Her Evergreen Soul. So you can find my writing or my podcast stuff there. Yeah, that'll help you find me.
Thank you, Amy. And again, for us, it's such a pleasure to have you and an honor to serve you. And I'm happy for your commitment to your health, to your body, and to your soul. Thank you so much, Amy, for your time. And we care about you, and we're so happy you're doing so many things for yourself and for the community as well.
Well, thank you, Dr. Nunez.
Take care.